Alcoholic liver disease is liver damage caused by alcohol abuse. The risk of developing liver disease correlates with the amount and the duration of alcohol use. Daily drinking poses a higher risk than binge drinking. Other risk factors include gender, genetics, and obesity. Alcoholic liver disease includes three disorders that develop in sequence: alcoholic fatty liver, alcoholic hepatitis, and cirrhosis. Alcoholic fatty liver is the accumulation of liver fat as a result of alcohol use. The liver is usually enlarged but not tender. So the liver is enlarged but not tender. There are often no symptoms, and the condition can be reversed if the patient stops drinking. Alcohol hepatitis is liver inflammation. Symptoms can range from mild to severe and may include fever, jaundice, and fatigue, and a tender, painful, and enlarged liver. Cirrhosis is when a large amount of hepatic tissue is permanently replaced with a non-functional scar tissue. So, high amount of hepatic tissue means liver tissues or cells, they are replaced with scar tissue. Known as fibrosis. So we have three alcoholic liver disorders: cirrhosis, alcoholic fatty liver, alcoholic hepatitis. Alcoholic hepatitis is the medial one, and alcoholic fatty liver can be solved. However, the cirrhosis is a permanent disorder. Symptoms range from those of alcoholic hepatitis to those of end-stage liver disease. The liver eventually shrinks. So here it shrinks. Okay, however, here it enlarged. Cirrhosis cannot be reversed. The liver is the major site of alcohol metabolism. Two main pathways are involved: alcohol dehydrogenase ADH and cytochrome P452E1 or CYP2E1. ADH converts alcohol to acetaldehyde. So alcohol dehydrogenase converts the ADH. Alcohol dehydrogenase converts the alcohol to acetaldehyde. A second enzyme, acetaldehyde dehydrogenase (ALDH), then metabolizes acetaldehyde to acetate. So ALDH, which is acetaldehyde dehydrogenase, this will change from or will metabolize the acetaldehyde to acetate. So here we have the two enzymes. Okay. People who have low levels of ALDH, acetaldehyde dehydrogenase, are more susceptible to toxic effects of acetaldehyde. Both of these reactions convert NAD plus to NADH. Okay, so they reduce the NAD plus to NADH. An increased NADH/NAD plus ratio, so NADH over NAD plus increased ratio promotes fatty liver. It promotes fatty liver by inhibiting fatty acid oxidation and stimulating fatty acid synthesis. So it inhibits the fatty acids oxidation and stimulates the fatty acid synthesis. In addition, acetaldehyde also promotes production of enzymes involved in fatty acid synthesis and inhibits expression of enzymes implicated in fat oxidation. So the ratio of NADH over NAD plus, if it increases and if we have acetaldehydes, it promotes the fatty liver and it inhibits both of them and inhibits the oxidation of fatty acids. Alcohol use has also been shown to reduce export of fat from the liver. All these events lead to fat accumulation in hepatic cells. Chronic alcohol use upregulates the CYP2E1 pathway. This pathway generates harmful reactive oxygen species which can damage proteins and DNA. The effect is exaggerated in patients who are deficient in antioxidants due to malnutrition. Chronic alcohol exposure also activates hepatic macrophages, triggering inflammation. In addition, acetaldehyde can bind to cellular proteins, forming so-called adducts that are seen as foreign antigens by the immune system, provoking the body's inflammatory attacks. Chronic inflammation and subsequent attempts at tissue repair lead to formation of scar tissue. And as a result, the liver internal structure is disrupted, impairing its functions. Scarring of liver tissue also obstructs blood flow, causing high blood pressure in the portal vein that brings blood from the intestine to the liver.